of decalcification. Decalcification क्या है? It is a process which complete removal of calcium from body tissue like teeth and other tissue, classified tissue. Decalcification कैल्शियम को टिश्यू से रिमूव करने के लिए किया जाता है. Principle: it is contained caused on the removal of calcium ion. The ions are derived from the decalcification solution, which is usually iron acid. A good decalcification agent should remove all calcium salt. मतलब कैल्शियम सॉल्ट को रिमूव करने के लिए किया. The technique of decalcification can divided into the following stages. तो ये 5 स्टेज में डिवाइड रहता है. सेलेक्शन ऑफ टिश्यू, फिक्सेशन, डिकैल्सिफिकेशन, एसिड न्यूट्रलाइजेशन, वॉशिंग. पहला सिलेक्शन ऑफ टिश्यू, बोन, कैल्सिफाइड टिश्यू और बोन. By using fine toothed bone or hacksaw thin slice of bone care obtained. The slice should not exceed 4 to 5 mm in thickness. The cut surface should be trimmed to remove damaged areas after decalcification and washing. Classified tissue. A sharp knife is used to cut calcified tissue. Duration of decalcification will depend on the degree of calcification. Fixation. Bone marrow is best fixed is Janker formal or any other routine fixative which may preserve the tissue well. Example, formalin. Next, decalcification may be carried out as follows. Removal of calcium by mineral acid. Use ion exchanges reasons by using of chelating agent. Electrolytes. Removal of calcium. Removal of calcium by mineral acid. Strong weak acid. Strong acid, nitric acid, hydrochloric acid, aqueous nitric acid, formalin nitric acid, formalin acid, good, and Stewart's fluid. Procedure. Calcified tissue specimens should be kept for complete decalcification in larger quantity of formic acid, sodium citrate solution. Wash in running tap water for 4 to 8 घंटे के लिए, हॉर्स के लिए. Dehydration. Impregnation should be done with paraffin bags. This technique gives better staining comparison of nitric acid method. Use ion exchanges rinses. Their rinses used for remove calcium ion for the fluid. The rinses is large on the better of the container. To container specimens is allowed to rest in. Advantage. Faster decalcification, tissue preserving, cellular details better preserved. And next, why using chelating agent? Chelating agent is a organic compound which power of binding several material. Next point, EDTA has the tower of chelating metallic ions like calcium. This is a slow process but has little or no effective other elements. Electrolyte decalcification. It is based on the principle of attraction of the calcium ions in a solution to a negative electrode. decalcifying agent of electrolytes agent. Hydrochloric acid 20 ml, 90% formic acid 100 ml, distilled water 100 ml. And acid neutralization. The tissue should be neutralized before washing by treatment with weak alkali such as 5 gram by 5 gram deciliter lithium or sodium sulfate. Washing. It is cried out for 2 to 4 hours in alcohol or overnight in water to remove alkali after the neutralization. Decalcification fluid. Gooding and Swart fluid, citric acid buffer, Jenkins fluid, formal nitric acid.